All right. Okay. Can you all hear me? Hi. All right. Greetings, everyone. Hi, Pat. All right. Welcome to the second day of the virtual Green Hospitals Asian Pre-Conference. The second session of our event is now in progress. So, a few reminders before we start. And after these reminders, the speakers for today will be given the blue badge, or I think they've already been given the blue badge, that will allow them to go on stage. That button can be found at the bottom of your screen. Please remember, you will be prompted by me when it's your time to go or leave the stage. As participants, however, you will not be able to turn on your microphone or video in the conference room. If you wish to ask a question or if you have any comments for the panel, please use the room chat found at the right side of your screen. You can try it right now if you would like so. You may use the reactions button found at the bottom of your screen to express agreement or show support to our speakers. The lounge, I don't think the lounge is open right now, but the cafe are open. The cafe is open all throughout the session if you also want to take a short break. Please do not forget to sign in the attendance sheet for your Day 2 certificate. Our chat facilitator, Paeng, will be typing in the link to the attendance sheet in the room chat. If you have any more questions or in need of technical assistance, please reach out to our chat facilitator, Paeng, via the room chat. So without further ado, let us officially start the session. I am Jit Suhal of Healthcare Without Harm, and I will be your moderator for today. I'd like to start by asking, how are you all feeling today or tonight, wherever you are? I would love to hear from our participants today from all over the world. So if you can just type your name if you haven't done so and where you are right now, share with us how you are feeling today. It can be through an emoji or through a sentence, I'm feeling ecstatic, or just share with us a heart eye emoji. Please do so that we can. Sonia is feeling good in France. That's good to hear. Doc Ming Nan from Taiwan, wonderful day. Hi Pitambar Adhikari from Nepal, Tilgangap, Nepal. Welcome, welcome. Very happy to have you all here. Miss Gloria, excited but with post-vaccination reaction. Well, I hope you feel better soon, Miss Gloria, but very, very happy that you're here. Hi, Shweta. She's in Delhi right now and air quality is not good. We'll talk about that later. Thank you, Shweta, for sharing. Sir Duenas, feeling Christmas and cold. Yeah, Christmas is right around the corner. A lot of participants from the Philippines and Sir Ricky, 1 a.m. Oh my gosh. I hope you get some rest after this. But again, thank you so much for being with us today. And we're really, really happy to have you here. All right. Please feel free to interact with other participants through the chat today. You can even direct message some of our participants today if you have anything to discuss with them, if you want to get their contact details and get in touch with them outside of the conference, please feel free to do that. All right. I just would like to give a background of our conference. The overarching objective of the pre-conference is to act as a platform for knowledge exchanges by consolidating the current accomplishments and also preparing for stronger healthcare commitments and actions on mitigation, resilience, and leadership towards the next Green Hospitals Asian Conference that will happen in India in 2022. Specifically, this conference will aim to define a climate resilient, equitable, and sustainable path of recovery from COVID and the climate crisis, address the challenges and barriers that prevent health systems from making strong decarbonization commitments, promote sustainable procurement as essential aspect to climate action, and expand and capacitate the network of health professionals, experts, advocates, and stakeholders, and activate them as champions in the field of sustainability and climate. So yesterday was the first day of our conference. Our theme was Path to Healthy Recovery. And the session was greatly and amazingly moderated by our GGHH member and RICE member, Dr. Glenn Paraso from the Philippines. We heard from Dr. Esperanza Cabral as our keynote speaker, addressing healthcare workers, industries, and health leaders with a call to action to rise up against climate change. Dr. Mark Jacobs of WHO, in his presentation, highlighted how climate change affects public health and the need for urgent response regarding issues affecting public health. Dr. Ravikant Singh from Doctors for You shared his experiences working in the middle of a pandemic on top of the climate crisis situation, and shared his country's situation in the state of a pandemic, reminding us that the climate crisis is a health crisis. And lastly, we also heard from Ms. Tipon, who shared with us the situation in their community in Marikina, Philippines, that how various organizations, allies, and community face so much disasters, the pandemic on top of that, and other local struggles that affect the community. We really had a great session yesterday, and we even had a networking session after that. Today's session, on the other hand, will focus more on mitigation, on decarbonizing Asian healthcare, which is the title of our session. This session will deep dive into how health was considered in the agreements and commitments made in the recently concluded COP26. It will also tackle the challenges and barriers that prevent health systems from making stronger climate commitments. We have 3 speakers this afternoon coming from Healthcare Without Harm Global and our GGHH member from Taiwan. And there will be an open forum immediately after the 3 presentations. So please feel free to type your questions in the chat box anytime during the presentations of our speakers, and we will make sure to address these questions to them during the open forum. So without further ado, I will start by introducing our first speaker for today. She is Shweta Narayan, our International Climate and Health Campaigner at Healthcare Without Harm. Based in India, Shweta is an environmental health researcher with over 2 decades of campaigning and advocacy experience in environmental justice issues. Her work has focused on providing legal, media, and scientific research support to the residents of pollution-affected communities and workers exposed to toxic chemicals. You probably have seen Shweta in the video that we showed you yesterday before the end of the first session in the TED Talk countdown video. So without further ado, Shweta, please go on stage now. Please, let's all welcome Shweta with a clapping emoji. Hi, Shweta.
Hi, Jade. Hi, everyone. Thank you so much for...
Turn off my microphone and then I'll make sure to share your presentation. Just give me a few minutes.
Yes, please. Good morning, good afternoon, good evening, everyone. I hope I'm audible, and thank you again for inviting me to this platform and to the pre-GHAC conversation. And I'm happy to sort of give an overview of the COP26, recently concluded COP26 event, and why it's relevant for us in the sector, in the health sector, and healthcare professionals, and everybody who is working towards strong climate actions, and why it's important to have health at the center of it. As I think everybody is aware, the recently concluded COP26 UN climate conference, had about over 40,000 delegates from 197 countries who met in Glasgow to work towards implementation of the 2015 Paris Agreement. And this was one of the first COPs where, in a large delegation, for the first time, health representatives and health leaders came together to communicate to the countries and their leaderships who were engaged in the conversations and the negotiations, to highlight that health has to be at the center of all the conversation, especially in the backdrop of the ongoing global pandemic. So I think this COP was special and important and extremely crucial, because we are still in a pandemic. We're still suffering and recovering and dealing on a daily basis from the effects of COVID-19. We are not out of the woods. And the COVID-19 crisis has shown us that how important it is to keep health at the center of all discussions and planning. Next slide, please. Before as a lead up to the COP26, the World Health Organization released its report, the annual report, which is titled The Health Argument for Climate Action, highlighting 10 calls. And this report was, compiled by WHO in coordination with global health community. And these 10 calls are absolutely clear and essential and important calls that the health community, as an appeal, as a lead up to the COP26, made to the COP presidency and all the countries involved. And if you look at the 10 commitments, I think these are absolutely relevant in context of Asia and Southeast Asia, and essential that, they are the backbone of all our future planning, and they should be the backbone of all our future planning and all our climate actions. So this was the strong sort of opening in terms of leading up to COP. Next slide, please. And then one of the first events that happened at the COP was a release of a report, which is the COVID-19 and climate smart healthcare and health sector opportunities for synergistic response to COVID-19 and climate crises. And this report is a new report in global practice, co-authored by Healthcare Without Harm, and it focuses on low carbon and climate resilient health solutions that present opportunities to build health systems that are resilient, that are pandemic prepared, and are also climate smart. I think that this is a very important publication that came out around COP, because it actually provides low carbon resilient solutions in health sector planning, which I think is the need of the hour and needs to be popularized. Next slide, please. Now, this was actually one of my favorite events at the COP26 this year. And this is actually a new introduction and a very innovative introduction called the Future Labs. And these labs were hosted by high-level champions of global climate action, Gonzalo Munoz and Nigel Topping. And they explored the bold and imaginative ideas for system change aimed at accelerating climate action and catalyzing the transition to a more equitable and just world. And in this session, we talked about from the health leadership from across the world on their vision of what the future of healthcare should be, and in this emerging scenario of climate crisis and challenges. And this session was called the Climate Smart Healthcare for Healthier Planet. And I mean, it covered different aspects of future of healthcare, people's aspiration, technical, the leadership, and also systems. Thinking in health systems transformation for to be future prepared. And I believe, and we have the host of this session in this panel, but I believe that this is going to be this was a very critical and important event, and I think this should be a component for every COP, and the lessons that we learned from this session should be incorporated and expanded and taken forward in all our work when we're talking about health and equity and justice in context of climate crisis. Next slide, please. And for the first time at the COP was a health pavilion by the World Health Organization that hosted over 60 events and in the span of 2 weeks. And these events showcased the health arguments for ambitious climate action. And this is again a very important moment, because this is the first time at any climate COP there was a separate sort of a earmarked session or space for health conversation. And this goes on to highlight that how important the health conversation in the climate conversation is, and how it has created its space, and it is sort of getting mainstreamed, and more people are sort of beginning to realize the convergence of health crisis and climate crisis, and the need to highlight the health aspects. Next slide, please. Along with the events that happened, there was this New York Times Climate Hub, which again talked about, one of the themes was future-proof health systems for a healthy planet. And we had members from Healthcare Without Harm, and we also had our colleagues from the health community who talked about leadership, health systems action, health workers' participation in highlighting the health impacts of climate crisis and doing their bit in kind of creating a just and equitable world. Next slide, please. Again, this COP was super important and monumental from another aspect, that this is for the first time at a COP or any other global event that I have seen, we had voices of 46 million health professionals who signed an open letter and presented to the COP leadership and the country leadership that were present at the negotiations. And this 46 million health professionals make up to 2/3 of the global health workforce. And their open letter called for all the national leadership to urgently step up on climate action and deliver a solution or a pathway of climate action that protects the planet, protects people's health, that is rooted on equity and justice, and focuses on the most important message was that in order to lead up and in order to act on climate change, we cannot have new fossil fuels. We cannot, we have to limit the global warming to 1.5 degrees. And for that, we have to say no to new fossil fuels. And this was a very strong message that went from the health community, again, reiterating that the climate crisis is a health crisis, and health sector, health leadership is speaking up and needs to be and demands to be heard, because when in all the crisis, it's the health community that is at the front line, fighting and protecting the people. So this was a extremely important landmark in the climate conversation. And coupled with this was a very interesting sort of event that representatives of World Health Organization cycled from Geneva to London to hand over this message, the call to climate action and the open letter, to a group of doctors who then cycled from London to Glasgow under the banner of Ride for Their Lives. and delivered this message to the COP leadership. Now, this initiative was interesting because it helped raise awareness on dangers of air pollution, on the health and climate change benefits of more active modes of transportation, such as cycling, and overall, it delivered the 46 million health workforce's message of no new fossil fuels and limiting the global temperature to 1.5 degrees to the COP presidency. So this again was a landmark moment, and a moment that all of us should collectively take pride in and should resolve to build on it from here onwards. Next slide, please. Actually, you know what? There were many landmark moments in this COP26. And again, this is another one of them. So the UK COP presidency, along with Healthcare Without Harm and World Health Organization, established a COP26 health program. It's a flagship initiative that brings stronger health focus and ambition to COP26. And the COP26 health program is built on two key aspects: on building on a low carbon health system and more climate resilient health systems. And we had 50 countries committed to this health program. And you can see the countries marked on this map, thanks to the World Health Organization for this map. These countries agreed to take concrete steps towards creating health systems that are resilient to growing climate impacts, developing low carbon health, committing to transform their health systems to low carbon and more sustainable. And out of these 50 countries, 14 countries have also set a target date for their net zero carbon emissions in health systems before 2050. So this again was an important historic moment at the COP, and we expect more countries to join in and strengthen this resolve of setting up low carbon and climate resilient health systems and healthcare in their countries. Next slide, please. So, I mean, right now, whatever I sort of highlighted was something that had happened inside the COP, during the COP negotiations inside the venue. I would like to now also highlight, and even though I have only one slide about it, but I wanted to highlight the health voices outside, which sort of supported the initiatives happening inside to strengthen the message to the leadership, the COP leadership and the countries, and strengthen the importance of health in the conversations and in actions. We had the Global Conference on Climate Change and Health, which was a day-long conference organized by the World Health Organization, Global Climate and Health Alliance, and other partners, which happened on 6th of November. That was a day-long event. We had health professionals marching the streets of Glasgow, highlighting that climate crisis is a health crisis. We had young health professionals from International Federation for Medical Students Association staging a die-in, which is sort of a very visual, strong message of inaction in an event that countries fail to take the right action at the right time. What would be the consequence was something that they highlighted in their die-in. We had parents, we had the largest number of parents groups again mobilized from around the world to send the message to the COP leadership that there is no space for new fossil fuels if we want a future that is healthy and sustainable and resilient. And we also had a very innovative exhibition called the Pollution Pods, which were set up at Glasgow, which showed this is an interesting sort of an experimental exhibition where in these pods, if you enter these pods, they will tell you, they had taken 5 polluted cities from around the world, and each pod would give you an experience of living in that city and breathing the air in that city. And it's a sort of a sensory experience, but a very strong personal experience of connecting with people who live in different cities. And the reason why I'm also talking about it is because right now I'm sitting in the city of Delhi, the capital city of Delhi in India, and the air quality is absolutely hazardous. And the message, how do we take this message from Delhi to Glasgow? This pollution pods actually attempted to replicate that by creating that sensory experience in the pods. So and many people went to these events. Many people participated and strengthened the voice. So I think and the direct actions and the health community marching in the streets of Glasgow were as important in highlighting the message of the climate crisis being a health crisis, and health being at the center of these conversations, as were the important events that took place inside COP26. And I would like to end my wrap up on COP26 over here, and I'm happy to take any questions if there are. Thank you.
Thank you so much, Shweta, for a very comprehensive summary of how health was considered and highlighted at the COP26. It's really amazing how health voices from around the world really contributed to these significant commitments at the conference. So we should all take pride that we were able to do this as health professionals and climate advocates. Thank you very much, Shweta. Would you like to show the video from the Vox Pop conference? From the event?
Yes, please. And as I said, that was a sort of a, for me personally, a highlight, because it actually brought forward the voices of our health leadership and their vision, which converged with our vision of a just and equitable world. So please, it would be great to show that video. Thank you.
Thank you, Shweta. You may now leave the stage and we'll show the video. Thank you so much. I'll call you again back to the stage for the open forum later. Thank you.
To reimagine healthcare, we start by asking medical professionals, students, health workers, and public health leaders 3 questions on their expectations for the future.
Where the partnership between people and the planet is recasted so that both can thrive.
The future of health in an ideal world is for it to be delivered within a sustainable and resilient health system that cares equally for the health of both the planet and people.
A significant global reduction in health inequalities that are currently caused by income disparities.
O futuro da saúde, no mundo ideal, devia sempre assegurar equidade, justiça social, direitos humanos e ética fundamentais.
Is not only equitable but also climate resilient, sustainable, and pandemic prepared, with healthcare professionals leading the way.
As a green run, where we not only improve the lives of the patient in front of us, but those who come after them.
A future where health is not a commodity, not a privilege, but a human right, accessible to all.
Planeta saudável e pessoas saudáveis começam com um comportamento ecologicamente correto. Esperamos que os legisladores façam a sua parte e garantam que isso aconteça.
They empower communities and local health systems as they know best how to improve the social determinants of health.
To prioritize health instead of wealth, which ultimately will lead to productivity in business and a healthy nation.
To consider environmental responsibility and sustainability as non-negotiables in their decision-making processes.
Have the courage to drive change needed to combat this climate emergency.
Let not the money dominate the health system.
Think about the people first, and secondly, I think that we must not adapt everything that the developed countries have. So in the developing countries, the policymakers must take into consideration the environment where we are. Thank you.
Minha demanda para os decisores políticos é soluções acessíveis e inovativas para a prevenção, diagnóstico e tratamento das doenças tropicais negligenciadas.
I am trying to step up efforts to reduce greenhouse gas emissions
and strengthen resilience and adaptive capacity to climate-induced hazards in my country.
Para agir agora pelo clima e a saúde, devemos nos concentrar em apoiar as estratégias de adaptação das comunidades locais para reduzir a sua vulnerabilidade.
To ensure that it has a minimal effect on climate change by advocating the use of reusable PPE, reducing the amount of single-use plastics we use on clinics, and focusing on the prevention of disease in my patients.
I'm exploring sustainability as part of quality improvement for the teams that I work in and developing sustainability networks for clinicians.
जलवायु परिवर्तन और स्वास्थ्य के लिए लोगों से बातें करें, कोशिश करें, चिल्लाएं, शोधों को उनके साथ बांटें। अपनी आने वाली नस्लों के लिए हमें धन नहीं, स्वस्थ पर्यावरण को छोड़ना है।
I am having those scary, hard, sometimes difficult conversations with our healthcare systems leadership, trying to drive changes and inspire changes in our operations and in hearts and minds.
Thank you so much again to Shweta for your presentation. And I'd like to also take the opportunity to thank all our health and climate advocates around the world and in the region and in this call who've done most of the work way before COP26. Really thankful for all the efforts that you've put into pushing for and advocating for climate action in the health sector. Thank you so much. Now we're going to move to our second speaker for this afternoon. Our next speaker is Dr. Ming Nan, who will share a testimonial in relation to his participation to COP26. He attended the conference and also spoke in one of the WHO Health Pavilion events. Dr. Lynn is currently the Vice Superintendent at Dalin Chuchi Hospital Chuchi Medical Foundation in Taiwan. He has a master's degree in public health and devoted himself to community outreach and international disaster relief. He is also in charge of the Green Hospital programs at the Dalin Chuchi Hospital, which won the 2013 International Environmental Friendly Hospital Teamwork Best Practice Award by the International Network of Health Promoting Hospitals and a gold medal in leadership of Healthcare Climate Challenge 2020 by Global Green and Healthy Hospitals Network. Hi, Dr. Lynn. Happy to see you on stage now. So please, let's give Dr. Lynn welcome applause. And Dr. Lynn, you may proceed with your presentation, and Pats will be sharing your PowerPoint.
Please share my slides. Hello, everybody. Thank you, Jet. Yeah, it's really my honor to be here to share some reflection on COP26. I'm Dr. Ming Nan Lynn. Next slide, please. Yeah, I think that we all know that there's not much time left, but are we there yet? So today, mostly I will think about how to, my reflection on how we increase the awareness of the healthcare sectors on climate change. Healthcare Without Harm has been doing this for more than 20 years. And then they did other things and provide many useful tools. But how to engage healthcare sectors to be more focused on climate change, it is that we think, I think that we should think about. Next slide, please. This slide is a report just published in August by WHO. This is WHO Health and Climate Change Global Survey Reports. And as you can see, only they study like 95 countries, but there only 26 out of 95 have assessed the climate resilience of at least one of their healthcare facility. So about 30% only that the hospital has climate resilience assessment. So I think that it is not enough. Next slide, please. As you can see, the Global Risk Landscape 2021, this is by World Economic Forum. On the X-ray and the X-axis to the right is likelihood. On the Y-axis to the up is impact. As you can see, the green dots, most of the likelihood and most impacts are related with climate change, such as climate action failure, human environmental damage, extreme weather, biodiversity loss, and natural resource crisis. Yeah, so I think that for our global risk, we need to put more focus on climate change issue. Next slide, please. Please show the video. Can you show the video? That's okay. That's okay. This is a speech that Tuvalu's prime minister. He stand on in the shore to announce that their country is now almost will be drowned. So yeah, it's pity cannot show the video, but that's okay. I think maybe some of you have already seen this video before. The things I thought in COP26 is that for a small island country, because they are threatened not only the health but the existence of their country because the sea level rise, such as Marshall Island, Tuvalu, these countries, they are almost like begging for all the countries to put more efforts on climate change because their country is almost will be flooded in the near future. Next slide, please. Now, this is a global map from different perspectives. Can you show the video? That's okay. So it is a different perspective of video. You can see the next slide. Please see the next slide. Yeah, this is a normal world map. As you can see, the area of different country. But next slide. Next slide. This is population. China and India, they have most of the population around the world. Compared with American, Canada, or Europe. Next slide. But next slide, please. This is people at risk. So as you can see, for poor country or most populated country, their people are at most risk. But like for the States or Europe, they are not at risk because maybe they are wealthier, and then they have the coping strategy for all the climate risk. Next slide, please. This is carbon emission. As you can see, the USA or Europe, they become larger, but for like Africa, they are not that big. As you can see on the right lower, Taiwan is there. Taiwan is a small island, but we contribute quite a lot to carbon emissions. So this is also we need to pay our attention to. Next slide, please. So as you can see, the injustice of country face different kind of challenge. Poor country, they are not that they emit not that much greenhouse gas, but because their potential to combat the climate change is not that enough. So it is not fair for the poor country, especially like for a small island country. And as for care sector and climate change, we need to do something to change. Please click and continuous click. We have to know why, what, and how. But during the COP26, as a hospital, we work on, we are quite environmental friendly hospital. We have been doing this for more than 20 years. So I went there, I want to learn more about how we can improve ourselves. But I think that maybe more compared with what and how. I think not most, but many of the lecture speech are still talking about why we should do that, because it will cause damage to health, and then the planet cannot endure this kind of human behavior. Yes, many lecturers still focusing on why, because I think that the people around the world, or professionals around the world, especially, I think that a healthcare professional, not that the awareness of climate change issue is not that focused, or is not that known by all our healthcare professionals. Although we have 46 million healthcare professionals signed up, how we want to reduce our carbon footprint, but I think it is not enough. We have to know why, because if we know why and we truly believe in that is our mission, we will shed our blood and tears and sweat to work on this. Next slide, please. So this is the diffusion of innovation. All these participants, I think here now in this conference, we are now, at least we are early adapter, maybe early majority, but we need to introduce this concept to our colleagues, to the community, to make it a momentum to adapt the concepts of climate change and health. Maybe the innovator and early adapter. I think that we have already, like Healthcare Without Harm or WHO has already developed many tools, but it's our responsibility to let others, the majority, maybe this 50% of the people, 50% of our colleagues, they still are not aware of that. This is very important for our healthcare sector. So maybe we are not only in the early adapter stage. We need to put more efforts to that early majority of our colleagues to know more, to know the reason why, so that we can push all the healthcare sectors to work on this. Next slide, please. So we all talking about action. Actually, we know I think that so many COP conference, every time when I join the conference, we are talking about action. So action is really very important. But when we receive so many messages of how this climate change issue is very important, human health is in danger. This is we call a climate anxiety. But if we can do something, then maybe we can reduce the anxiety, climate anxiety. Next slide, please. So this is Swart said that there are more than 60 sections in the WHO COP Health Pavilion, talking from leadership the first day, and then finance and loss and damage and food, and so many sections, so many topics has been covered in how and what. But this how and what, there are so many innovators or early adapters work on how or what we should do and how we do it. But we need to build up, scale up the capacity so we can, most of the healthcare professionals work on this. Next slide, please. This is what and how. WHO have quite a good website on climate change and health. The QR code is there. There's so many tools and information on this. Next slide, please. And also, Sreta has already talked about the health argument for climate actions. Next slide, please. And this is healthcare without harm. There are also many information and tools for us to adapt to reduce the carbon footprint for our healthcare sector. Next slide, please. This is global roadmap for healthcare decarbonization. Sonia will talk about it, how we can race to zero by the year 2050. Next slide, please. So what I was invited. I will deliver a speech on WHO Pavilion at day 2. Pro-Veg is NGOs, international NGOs work on food because we want to reduce the food. We have provide sustainable and healthy food, and Pro-Veg is NGOs promote plant-based diet. And I was invited there. I told them I work in the hospital. I do green hospital program. And they said that, yeah, we know that you do green hospital program and your hospital is provide only plant-based diet. And then maybe the audience want to know healthcare professionals in a healthcare facility, what else we can do. So I share with them what we have what we have already done on energy, on water, on transportation, all these kind of how and what in healthcare facilities to reduce climate impact to the environment. But as for my opinion, because we know that there's so many things that we have to do, maybe from different countries, it will be different because of the policy, because of their healthcare sector, their regulation, so many different kind of things. So we need to adapt these principles to our individual country or facility, and then as long as we know this is what we have to do, so we can think about something to reduce the climate impact by our healthcare facility, even from our daily practice. Next slide, please. Yeah, so because we know there's so many things to do, we know that the time is short, we don't have so much time, so we need to do something for ourselves. Maybe we can do from ourselves, so we don't use disposable utensils. We adopt more plant-based diet. So this is a daily practice. If we can do it by ourselves, maybe we can be the example about colleagues and also lead to the 1,000-mile journey. We have to do from ourselves, from our facility, and then maybe from our with our colleagues. Next slide, please. Yeah, this is I love this proverb very much, because if we want to work fast, we work alone. But if we can work together, so we can work far, we need to call on our colleagues from healthcare sector. Not only that, our patients, because we know that healthcare professionals are among the most trustworthy professionals. But nurses is better than doctors. Nurse, doctor, pharmacist, we are all most trustworthy professionals. So we want our environment, we want our earth to be better. We need to call upon them to work with us, then we can work far. Next slide, please. Thank you. And then this is my sharing. Thank you.
Thank you so much. Thank you so much, Dr. Lynn. I really like every time that you present. That quote is always at the end of your presentation, and it's good to be reminded that this is a collective effort, and we shouldn't do this alone, and that we should always be reminded, and we should not forget why we're doing this, the whys of the actions that we're taking to advance climate action in the health sector. So thank you so much, and also for thank you and congratulations for your presentation at the COP26 Health Pavilion event. We watched it at Healthcare Without Harm SEA team, and we're really proud and thankful to have you as an advocate for climate action in the health sector. All right. I would like to remind the participants to please write your questions in the room chat if you have any. We are now at our third speaker for this afternoon. She will be talking about the decarbonization roadmap, the race to zero, and among other things, on what tools and materials and support that we can provide health systems and countries in relation to achieving commitments that were done at the COP26 climate and health event. So Sonaroshnick is our next speaker. She's the International Climate Policy Director of Healthcare Without Harm. She has worked in health and social care internationally and has extensive experience in various roles as a clinician, a member of senior hospital management, and in sustainability roles. Prior to joining Healthcare Without Harm, Sonia served as the director of the Sustainable Development Unit of England's National Health Service. She holds a master's degree in systems thinking and is a member of the Faculty of Public Health in England. So let's all welcome Sonia, and please give her a warm virtual round of applause as well. Sonia, you may now go on stage.
Everyone, it's wonderful to be with you today, and thank you for that that warm welcome, Manjit. I'm delighted to be here with you, and I would like to just echo some of the things that Shweta and Dr. Lynn have said. That you know, every one of you has contributed to this amazing moment, and it does feel that there's been a kind of acceleration of action and awareness around health and you know, and the climate crisis, recognizing that the climate crisis is actually a health crisis. So I would like to, just as Manjit said, thank all of you for the fact that you are working so hard on the ground to make this happen, because actually it is this collective action that is going to get us you know, to zero, which is where we need to be, where we all need to be trying to go. I'm going to talk to you a little bit about some of the how, which is what Dr. Lynn was highlighting, and also highlight some of the things that we're going to be trying to do during this next year to help us get to how faster. So if we move on to the next slide, you'll recognize the brand, which was amazing to have at COP, a kind of unifying message for all of the health moments, trying to highlight that actually whatever you do now that will help climate will also help health. But I would also like to advocate for the fact that if you can help health, you can promote healthier people, you will also be helping the planet. So it works both ways, actually. Climate actions are health actions, and health actions can be climate actions as well, if done in the right way. So the next slide, you will recognize that is the World Bank report that was launched, and it is, as Shweta said, incredibly relevant, because not only is the climate crisis accelerating, not only are we still in a pandemic and likely to have other pandemics, but we need to find ways of responding to both that are built on raising building prevention, building preparedness, and making sure that actually nobody is left out, that everybody is included in this process. And from my perspective, systems change and transformation of the health system is absolutely fundamental, because our current systems, often that have been developed in the West, are too intensive. They're not necessarily focused on health, and they're definitely not equitable. So we need to find an alternative way. So I'm going to talk to you now, if we move to the next slide, a little bit about the carbon footprint of the healthcare and what we can do to reduce it. And this figure, which was published in 2019, is now quoted an awful lot around the world, that if you add up all of the health sector's carbon footprint around the world, you would get to 4.4%. And that is equivalent to a country, if you were to view it that way, and it would be a country number 5 on the list of high-ranking countries. The scary thing, though, is that as we see different countries developing their own baseline for what their carbon footprint is, that actually this report is probably an underestimate of what the carbon emissions really are around the world in healthcare. So everything I'm going to say to you around what we can reduce and how we can take action is based on what we know, but is probably still an underestimate of everything that we need to do, and the numbers that are really out there when you can add it up, bottom up. So if we go to the next page or slide, you'll see that we developed a roadmap for healthcare decarbonisation around the world. And if you keep clicking, that would help me. The thing that this roadmap tries to highlight is, by using evidence that's available in the world today on decarbonisation actions, it tries to highlight the size that would, the impact that would have on our global emissions. And we've tried to position it in a way that is going to be, equitable and highlight justice amongst nations. But of course, that needs to happen within countries as well. So the big conclusion really from this roadmap is, even by doing all the things that we know of already and doing them well, we will still need to dig deeper and go further and try and transform the health system so that it's actually really a system that is trying to achieve health rather than one that is just trying to curb sickness. So that is the main message for you today. If we move on to the next slide, please. This is why it is so scary, and why we so need to act immediately. The first dot highlights the 4.4% that we talked about, and if we do not do anything, by 2050, the emissions will triple. Now, that's because of all sorts of reasons, but including the fact that we need to ensure that we deliver good universal access to healthcare around the world, and that we're dealing with an aging population, with a growing population, new diseases, and all sorts of things. So the health sector needs to work harder, probably, than most other sectors, to try and bring this down. And some of that is very much in our hands to manage. So in the next slides, I'm going to talk to you about some of the things that we modeled to take that down. And I'd like to reiterate something that Dr. Lynn said, is that this is everybody's business. It's everybody who works in some form connected to the health sector can do something about that. Whether you're, a nurse, who we know are absolutely key professionals, a doctor, a pharmacist, whether you're working in, energy management, whether I actually think that as a patient, you're also part of the health system and you've got a role to play, because by looking at health in a holistic way, you can really have an impact on how much it is used and the way things are managed. So just as an example, if you are prescribed lots of medicines, there is something about how those are well utilized, and that involves you as a patient as well. The next slide, please. The roadmap is really predicated on making sure that everybody has to start acting now and doing, making changes to the health system to reduce emissions, but it recognizes that some countries have got a much higher responsibility to do that quicker. So this yellow line that you can see there is really all the countries like the United States and a lot of European countries who need to be reducing at about 7% a year and bringing down their emissions incredibly quickly. So I'm really pleased that in the countries that have committed to decarbonize, we have got the United States, the UK is there, Germany, Spain, Belgium, quite a number of those countries are signing up to this rapid decline. That they represent in themselves nearly over 50% of the carbon emissions around the world. So you can see why it's so important for them to do so and do so rapidly. For other countries, though, you see that there are various other routes to get to zero. But the important point here is everybody needs to be reducing to zero by 2050. And that's why the Race to Zero was launched and why we are talking so much about all the different actions that people can take. But what we recognize is that in some of these scenarios, we make sure we develop good access to healthcare that is green and decarbonized, that is resilient and equitable, because that will not only help us with reducing emissions for climate change, but also build resilience, reduce equity, and fundamentally, it will be a healthier system for everyone. So I'll just talk to you about some of those now in the next slide. If you just click through the three pathways, thank you. These are the three aspects where health systems can really make a difference. The first one is through the way we manage our systems, and that's some of that we know well around energy, around how we manage the operations, how many, it's all the stuff that happens in health facilities. The second one is really about the supply chain, and that's the products that are utilized. And do make a difference between the products are utilized by the healthcare system in pathway 1, and if we use them well, we can actually reduce the amount that are used. So the health facility includes some of that. The second pathway is around the supply chain, and that's very much the decarbonization of products, and that's really important to achieve as well. And the third one really is that the way a hospital, a health facility, or health professionals operate in the world will have wider transformation on society, and will help that transformation that we all need to make. So Dr. Lynn's example of making sure that there is a hospital is very pro-vegetarian or plant forward will have repercussions on the local economy, on agriculture in that country and beyond. And that's the kind of transformation we're talking about there. And then there's this yellow piece, which is at the very bottom of the graph, which is really about how we go even further in order to get to as close as we can to zero in the health sector. And that is about delivering care in a very different way in the future. And I'd like to talk to you a little bit about that later. So if we move to the next slide, and if you can just, as you move to the next slide, just click on all of these different interventions. They're groups of interventions which we know will reduce the carbon emissions in healthcare. And you can see many of those that you will recognize as standard ones that we advocate for on a regular basis. Because of course, if we can have 100% renewable energy, it will not only mean that we're using less fossil fuels, but we're also building a more resilient setup for, in case of adverse weather events or other actions. So, there's a lot of these that are absolutely necessary, both for decarbonisation and for building resilience. But I would like to highlight the one that's in red, because that's pharmaceuticals. And if you look at the carbon footprint of healthcare, there is in many countries well over 30% of the footprint that relates to the medicines that are utilized. So how we prescribe medicine, how we utilize them, and how we maybe swap for alternatives is really important. The size of this one is pretty small compared to the whole, because it's only highlighting the changes that we can make in anesthetic gases and in inhalers by switching to alternative products without impacting at all on clinical quality. But if you can imagine that we did that across many other medicines and type of attention, where maybe we could include social prescribing or include better diets or include more exercise as part of the healthy prescription, that red wedge on the graph would be much bigger. I think the other one I'd like to highlight is the bottom one, which is around really having effective health systems. And what we did was to analyze data from IHME, who look at the sort of amount of money that is spent per patient per year in a health system, and how much of the indicators of the universal health coverage that they actually reach. And what is staggering is that there is a lot of disparity here. There are some countries who spend 2 or 3 times more money per patient that don't achieve better outcomes. So the system of care matters hugely, and the more it can be focused on prevention and preparedness and ensuring resilience within communities, the less people will need to be rescued through the hospital system. And that is really important if we're going to be developing care for the future, as there's going to be more weather events happen. We need to be very careful about the design of our health facilities. And I would like to suggest that we need to focus in on what a green universal access to healthcare looks like. So that is green, resilient and equitable. It is not about replicating the Western model, because we know that that does not give anything good for the planet, and it doesn't give anything good necessarily for health either. And it is highly inequitable. So there is a lot of work that we can do in that way. If we can move to the next slide, please. This is the sort of some of the areas that we need to explore. So in our actions, we need to do all the things that we know about, that you are all doing, and probably go beyond. And some of these are the things that we think might help. In terms of, I've talked about Green UHC, there's a lot of work that's happening around telemedicine and virtual appointments and mechanisms to monitor health and support people to be healthy that are not necessarily needed in a building, but can be done in a different way. Obviously, disease prevention I see as a form of climate change prevention. So if you can reduce the use of tobacco, reduce high levels of obesity, you are actually also helping to make sure that people don't need hospitalization and can lead a healthier life. So we do need to look at how we manage all of these different things. So I've given you a very high level about globally what we need to do, and we've now got these 50 countries or 47 that have signed up to decarbonizing their health sector by 2050, which is absolutely amazing, and we need to support them in every way we can to do that. We're hoping that more countries will join, and this will start becoming, much more standardized practice. But there are other things that can be done. So if you move to the next slide, we've got the healthcare climate champions. I said the healthcare climate champions. It's the climate champions. I wish they were healthcare climate champions. They probably are, because they actually have recognized how important health is. And Healthcare Without Harm is the partner to Base to Zero. And there are over 14,000 health facilities that have joined through various, through about 52 institutions around the world. And these organizations have pledged before the countries to say that they'll reach zero. And a lot of them have pledged that they would reduce their carbon emissions by 50% by 2030, including scope 3, which is all the different products that we buy and utilize. So that is an amazing voice of confidence from hospitals and the health sector to make sure they can do that. I'm also delighted to say that Kerala as a state has actually signed up, and that there is a lot of work to be done to support that as a whole health system to race to zero. Many of the actions that I've highlighted in the roadmap will be the sorts of actions that facilities need to do as well. And the idea is that we can learn from each other and race together to zero. The idea that it's a race, I think the climate champions would like to say it's about everybody joining the race. And most importantly, it's about everybody getting to the end of the race, because if we don't all get to the end, then we're going to be in trouble. So this is the collaborative race together to get there. And, you know, I'd like to, if we move to the next slide, you'll see the sort of the requirements that are made for the race to zero. And there is this 50% by 2030, or a fair share depending on which country you're from. Net zero by 2050, definitely. An action plan by this autumn, and yearly reporting. And this yearly reporting is really important because it's really starting to highlight that we need to be very transparent about our carbon emissions and how we're reducing them. And my view is that a health facility should have that as a contract with their population and their communities. If we want to, highlight the progress, it needs to be very open and very transparent. We do have financing in public reports, so we should be doing it with carbon footprints and highlighting to communities what we're doing to reduce emissions. Because as Dr. Lynn and Shweta said, health professionals are very trusted, and if health organizations demonstrate that this can be done, it will have an impact way beyond the hospital or the health facility. So just to summarize and conclude, if we move to the next slide, it's absolutely crucial that the health sector takes a road to zero emissions. And because the health sector is so key to this, it will really help the rest of society to accelerate change in the rest of society. So I guess I'm counting on all of you as representatives, perhaps that's one way or another, to keep working as hard as you've been doing in the past years and really accelerate this action, because it will make a fundamental difference way beyond our walls. And we will be working this year to support you with that. We're looking at how we can develop much more sort of customized information and support for countries based on some of the roadmap information, but based also on what we know the systems of change need to be if we want to move to zero. And we hope to be working with many of you on what that really needs to look like if we want to accelerate change. So I look forward to that partnership with you. And so if we move to my next slide, I'd just like to thank all of you as health professionals who've either been battling with the COVID situation or who are fighting climate change in every situation that you're in, but also who are bringing hope to the fact that we can actually do it if we work all together. So thank you very much, and back to you, Manjit. Thank you.
All right, thank you so much, Sonia, for your presentation and for giving us an overview on the many ways that we can support these countries and our health facilities who have committed to stronger healthcare, climate resilience, and sustainability in the sector. So thank you once again to all our speakers. I know you just left the stage, Sonia, but I'm going to call all of you again to go back on stage. Shweta, Dr. Lynn, and Sonia.
Sorry.
It's all right. Please kindly keep your microphones on mute when you're not speaking so we can avoid feedback. But please go on stage right now. Shweta, Dr. Lynn, and Sonia. I think, yeah. I think can we give Sonia, Shweta, and Dr. Lynn the hosting capabilities? I think they lost it. All right. All right. Dr. Lynn is now on stage. Hi, Dr. Lynn.
Hi.
All right. Sonia is now on stage. I'm trying to see if Shweta is still here, but I don't see her in the room anymore. But it's okay. She probably has another meeting in between this conference. So, but we'll continue with the open forum. Thank you again so much for all your presentations. We are very grateful to have you here and to share, Dr. Lynn, your experience and your reflection on COP26. Sonia, all the amazing work that Healthcare Without Harm is doing in supporting countries and health facilities in the race to zero, reducing emissions, and decarbonizing the sector. So I would just like to keep this open forum short, since we're also running out of time and we still have a breakout session after this. We have a couple of questions. One of them is in the chat, and I'll start with that. Siti from Indonesia, if I'm not mistaken, asked if our hospital is not a member of GGHH and we cannot access the carbon footprint calculator application in the GGHH website, how are we going to calculate the carbon footprint or total emissions in our hospital? Is there any specific tool that we can use? I'll ask first Sonia, and maybe Dr. Lynn may share some experience as a GGHH hospital calculating their carbon footprint emissions.
So thank you very much. It's true that the calculator, the checkup calculator that we've got in GGHH is for GGHH members, and I would really recommend that you join GGHH because it's totally free, and there's a lot of tools that are available there that you can utilize. And it's like joining a family, a network of people who want to all work together. So you can link in and ask questions. If you want to do more, you can join. There's a climate challenge. You can join Race to Zero if you want to. There's lots of different things that you can do there. So I would really, I wouldn't worry about the fact that you maybe you haven't yet established the carbon footprint for your facility. I would encourage your organization to join, because it will help get the board of your organization, the directors, on the journey as well, because some of it is about calculating your footprint and developing an action plan, but some of it is also getting all your hospital directors understanding the work that they need to do and how to develop an action plan. I mean, there are other tools available, but I think ours is actually quite comprehensive and is really worth utilizing. We're going to actually be piloting it with WHO with some countries in 2022, and we're also working now to add in a sort of a hotspot calculator for the scope 3, so that you get a broader approach. So that would be my main answer. But if you want to discuss this kind of thing further, I'm sure that many of us would be very happy to do so.
Thank you, Sonia. Dr. Lynn, would you like to add to that and share your experience as a member of GGHH and able to measure your carbon footprint and all the amazing knowledge, resources, and opportunities that GGHH offer to its members? Dr. Lynn?
I'm sorry.
Did you hear, were you able to hear that, Dr. Lynn?
I can hear very clearly.
Okay. Can you hear it now?
Yeah.
All right.
Okay. Can I share some of my experience?
Yes, please do, Dr. Lynn.
Okay. Like Sonia say, I strongly recommend that hospitals, you can join the GGHH, and then they have like Hippocrates, You can log in and then track your annual like energy or watt or this kind of Hippocrates. They have some calculator, but NHS, National Health Services of UK, they already pledged to be carbon neutral by the year 2040, and they have some. They shared experience during the WHO Pavilion about the scope 1, scope 2, but I think that scope 3 is a problem. It is not easy that we have a very exact calculator for scope 3. I'm very glad that Healthcare Without Harm will cooperate with WHO that we can provide some information, the calculator for scope 3, because if you want to really become net zero, that we need scope 3. But I think that it's not easy because you have to work with the supplier, because procurement is very important. So this, I think it is still under development, but I hope that we can really now have some useful tools, especially for scope 3, that we can provide this kind of information for us to calculate our carbon footprint.
Maybe I can come in because the most important thing, I guess, is to just start anywhere that you can start. And I think joining GGHH is a really good starting point. But in terms of carbon emissions, there's everything that is happening within the hospital, the energy bills, all of the different aspects that you can already start looking at. The scope 3 that Dr. Lynn is talking about is really all the products that we buy and utilize in hospitals and facilities. And that includes, things like medicines, it includes all the protective equipment like gloves, it includes, all the machinery, it includes the beds, it will include everything that you utilize. And making sure that those are good choices in that they are not toxic, they're not carbon intensive, that they can be reutilized wherever possible is really important. And you can do that. I mean, what we're trying to do is establish how we can calculate the carbon footprint of those things and include it in our overall baseline. You can still work on it even without always understanding exactly what the size of the footprint is. And at the moment, what we're trying to do is establish where there are hot spots, where there are big areas. And I just would like to give you an example from a hospital around who've looked at their use of gloves, of non-surgical gloves. And it's the reason I'm highlighting this example is because it's not just about the suppliers, it's also about how we utilize products. And these nurses in Great Ormond Street in London, the infectious control nurses noticed that some of the staff were using gloves more than they needed to. Really, they were using them all the time. They were using gloves to push a wheelchair, to do things that really are not necessary. And you don't need, for instance, gloves generally to give an injection. There's a lot of, we've become overly, we use them too much. And they started raising awareness with their staff to say you don't need to use gloves all the time, think about it every time whether you use them. And by doing that, within a year they saved 7 tons of plastic. That's just one hospital. And plastic is a very high carbon item, so if you can reduce the use of plastics, you'll be reducing carbon. And that's part of what we need to start looking at, is how we utilize products, how we manage our waste, how we use things to reusable, and wherever possible engage with suppliers to look for better alternatives. Thank you.
Thank you, Sonia and Dr. Lynn. I think Dr. Lynn got I think he's back in the participant list. Can someone give him hosting access again so he can join the stage? Thank you. Sonia, there's a question here directed at you, and I'll start with that while waiting for Dr. Lynn to join back. Could you elaborate the concept of climate justice further from Pitambar Adhikari?
Yes, thank you. That's a good question. I think the Dr. Lynn highlighted through his very useful maps the difference across the world between the people who are emitting carbon emissions and who've been doing it for years. In fact, it's not just now, it's been for a long, long time. And the map of people who are most vulnerable to climate change. And really, the concept of climate justice is to try and make sure those maps are not as bad as they are. So for one, for the map where all the highest emitters are, ballooning out and emitting lots of emissions, they need to be reducing that rapidly, because people in the Western world and within healthcare systems in the Western world are using more carbon than is okay or is acceptable compared to other parts of the world. And the other part of it is that we need to really support the people that are most vulnerable in this world to be able to deal with the effects of climate change, but also to be able to lead a healthy life. And I'm a great believer in the fact that if we develop the right models of care to support both resilience and equity within countries, we can actually deliver better healthcare systems that are less, draw less on the high intensity models of the West. And that's what we need to try and do. So climate justice is about redressing the balance, and I would like to see it go more than just redressing the balance. I'd like to see the balance tip the other way, but we've got a long road to get to that. So the main thing is that there are some parts of the world that have a higher responsibility to tackle this really quickly and aggressively. And at the same time, we need to support countries who are still trying to make sure that access to universal healthcare is being done and developed in the right way, that you have every opportunity to do that in a resilient and equitable way. So I hope that there may be others who want to add to that. I hope that gives you my sense of what it means.
Thank you, Sonia. I think you were able to summarize the concept and made it really understandable. Dr. Lynn, do you want to add to that discussion on climate justice? Before we wrap up the open forum. Thank you.
Okay. Thank you. That because we healthcare sector we aim to care the health of the people, but we all know that we have produced 5% of the carbon emission. Is the 5th largest emitter if we are a country. So it's our duty, because it's our responsibility to care for the health of the people. But now we know that because the climate change will damage the health of the people we want to care. So during the process, we give the services to our patient in order to get them become healthy. That we should not put more health burden, risks on their health. So I think that, but it is not easy, because the health education. So I'm now working on how to increase the awareness of the young generations, that we need to do that, because traditionally medical education is not put so much emphasis on this. So for our young generations, and not only young generation, I think that all of the healthcare professionals, we need to do that, because we want to, not only the personal health, but also the planetary health. Yeah. Thank you.
Thank you so much, Dr. Lynn and Sonia. I'm afraid we will have to wrap up our open forum and end at those 2 questions. But if you still have a couple of questions from the participants, please do email us at the email address that chat facilitator Paeng pasted on the chat box. And for those who are interested in joining the Global Green and Healthy Hospitals Network, we'll also type in the link on how to join the network on the chat box. And please approach any of the members from Healthcare Without Harm Southeast Asia who are here today and ask about how to become a member. So again, thank you so much, Sonia and Dr. Lynn, for your time and your efforts today. And thank you also to Shweta, who's not here anymore. You may now leave the stage. And while we're preparing for the breakout session, we'd like to show you a video on Race to Zero in Southeast Asia. And I'd like to apologize to Dr. Lin earlier in his presentation that we weren't able to play the PowerPoint, the videos in your presentation. I will make sure to play them later on this afternoon. Thank you so much, and please enjoy this video. Thank you, Pat. Thank you to all the hospitals who have joined the Race to Zero from Southeast Asia in the Asian region. We're very, very happy to have you. And if you are from a health facility who would like to join the Race to Zero, please feel free to message us, any of the Healthcare Without Harm staff who are here today, and to ask about how to join the Race to Zero. Okay, we are now at the portion of our program where we will discuss in groups and have group discussion on how do we move forward from here? How do we support our countries and our health facilities in decarbonizing the health sector? So I'd just like to give you some reminders before we go to the breakout rooms. So if you click the showrooms at the topmost rightmost of your screen, you will see two breakout rooms, breakout A and breakout B. I can see some participants are already there, but so I'll be quick. You will have a facilitator and a documenter in these breakout rooms. Breakout room A will tackle about country level health system decarbonization, and breakout room B will tackle health facility level decarbonization. So there are prepared questions that the facilitators will ask you. The facilitator for breakout room A is Sir Mon San Pascual, and I will be the documenter. For breakout room B, it will be Dr. Ming Nan, and the documenter will be Paeng Lopez. So yesterday I asked you to sign up in these rooms, and these are the names who have signed up in these rooms. But please feel free, the rest of those who haven't signed up, please feel free to join breakout room A. We need more participants there. So you will have approximately 20 minutes to discuss as a group, and just make sure that because as you know, you probably have experienced the lounge area. If you move away from the group, they will not hear you and you will not hear them. So we have made sure that when you go to the rooms, you will be able to use the megaphone so that wherever you are in the room, everyone will hear you. But please raise your hand first, or ask the facilitator if you can speak before talking, so that we avoid talking at the same time. So, all right, I will now stop sharing, and we can now go to our respective breakout rooms. Again, there are two breakout rooms, breakout room A and breakout room B. Please feel free to join any of the breakout rooms. You don't have to be a health facility to join breakout room B, and you don't have to be a national government or a member of the Ministry of Health to join breakout room A. Anyone can join any of the groups, and the facilitators will also give you guidance on how to how the breakout discussion will go. So please join the breakout rooms that are now open. I can see breakout room B already having 11 participants. Please join breakout room A.
What is CL?
Can you all hear me?
Yeah, we can hear you.
Now you can see I'm using a megaphone. So this will allow me to be heard by everyone wherever you are in the room. So I would suggest that we also utilize the megaphone for anyone who's going to speak. But our facilitator today is Sir Mon. Sir Mon, when you speak, please make sure that you press the megaphone by clicking the megaphone icon so that you can be everyone in the room. So I will now turn over the floor to Sir Mon to facilitate this, and maybe you would like to give an introduction, and then I will make sure that the documentation is shown in the screen so everyone can see what we're discussing. Thank you.
Good afternoon, everyone. Do you hear me? I hope this megaphone is working fine. I am Ramon San Pascual. I'm with the Healthcare Without Harm Southeast Asia, and for this afternoon, my role is to facilitate Group A or Breakout Room A. And you chose to be on a session that will discuss country-level health system decarbonization. And there is so much that you have heard from the three presenters during the plenary. But first of all, let us have this opportunity. We only have 30 minutes, but I think it's fine to have quick introduction. Cite your name and the organization that you represent. And every time you will want to talk, use the megaphone, press the megaphone, okay? So, Sir June Philip, can you start? Maybe let's make it random. Whoever wants to grab the megaphone, introduce yourself and your organization, please. Starting now. Do you hear me? And you should unmute yourself so you can speak, okay?
Hi, hello. I'm Dr. Hello, I'm Dr. Madison Dominguez. I'm a medical officer 4 of the DOH Central Luzon Center for Health Development. So I'm in charge of Health Facility Development Cluster. So I guess that's it. Medyo naninibago sa, I'm having naninibago sa buttons. Thank you.
Oh, thank you. From Region 4, CHD of Department of Health. Okay, who wants to? Lieutenant Colonel Amita Nase, I see that you have the megaphone sign. Can you speak? Can you introduce yourself?
It's the megaphone.
Yeah, Amita Nase has the megaphone. Please introduce yourself.
Hello, can you hear me? Sir? Yes, sir. Good afternoon, sir. This is Lieutenant Amita Nase. I am a critical care nurse, worked in the Army for the last 24 years. And I am now joined to ANU organization for this great
There.
Hello.
There. Go ahead, Lieutenant Amita.
I think we lost her. Okay, maybe we can start the discussion, and then the moment you speak, please take that opportunity to also introduce yourself, okay? So as not to consume our session time. So there are 3 questions that we want to address to everyone. And let me read them, and maybe you can begin thinking of the response from your own context. 1, are there challenges that hinder your national government from committing to sustainable low-carbon initiatives in the health sector? If yes, what are these challenges? So that's the first question. Challenges hindering your national government or your Ministry of Health from taking up low-carbon initiatives in the healthcare. And then there is 2. The second is about the tools, and then the third, if your government attended and committed to the health priorities in the recent climate conference, what do you think are the tools and resources you will need to help your national government? Okay, so those are 3 related questions. And let's make this a freewheeling discussion. I know that it's quite intimidating, this platform, but just grab the mic, the megaphone, and speak up. Okay. And you can use the chat if you're having problems. You can type your thoughts, and someone can read it for you. Is that okay? So shall we start? And introduce yourself if you haven't done so yet. Thank you. So the first question, challenges to your national government. Go ahead. Well, if you don't, you're speaking. What, Jit?
It's okay. I was going to say that feel free to start talking.
Yeah. Let me call on someone I know, but is not from the Philippines, to start off, to start the ball rolling. Ishika, Dr. Ishika, can you answer the first question, or even the related 2 and 3 questions, please, and introduce yourself?
Yeah, sure. Hi, everyone. I'm Dr. Ishika, and I'm based in New Delhi. I'm from India, and I work for the Sustainable Health in Procurement Project in Delhi. So the first question is, are there challenges that hinder your national government from committing to sustainable low-carbon initiatives in the health sector? Yes, definitely there are challenges at policy level, because first of all, we lack a lot of awareness and existing policies that are based on sustainability. And in terms of focus on health initiatives also, whether it is related to climate change or sustainable procurement or other parameters, there are no definite guidelines in focusing on health. So that has been the main thing, to bring on health into the dialogue of this. I mean, there are existing public policies, but you won't find the focus on health. So that is the main challenge, I would like to say. And a lot of awareness has to be done, as we know, the population of India and how diversified the health sector, and it's a state subject moreover. So these are the key challenges I would like to list.
Thank you, Dr. Ishika. You would see that we have our whiteboard in front of us.
Ron, please use the megaphone.
Oh, sorry. Yeah, so you can see that there is a whiteboard in front of us. Everything that you're saying is being summarized under each of the questions. Okay, let me call on the next one who wants to share the thoughts on the first question, or on the related 2 and 3 questions. Okay, grab the megaphone, please.
Here, maybe he would like to share some of his thoughts. Sermon, he's up there.
Who? Who did you say?
Dr. Ray. I think he's speaking.
Dr. Ray is up there on the board. Dr. Ray, we see you. Can you speak up, please? In this
Okay, can you hear me clear, Mon?
And to make a brief introduction.
I picked the megaphone now. Can you hear my voice?
Yeah. We hear you.
Can you hear my voice, Mon? Jit?
Yes, Ray.
Sure. Thank you. It's really happy to meet you all again in these forums. Allow me to introduce myself. My name is Dr. Reynaldi. I'm from Indonesia, and I'm also coming from parts of RISE Alliance of Climate and Healthcare. I want to give some point in the first questions. In my countries, there are quite burning issues now, since Indonesia is one of the countries that been committed to add healthcare sector on the decarbonization program towards in the last COP26. But the problem is we are lack of knowledge and where should we start. All of the organizations now try to build the momentum. from hospital accreditation, they try to make a toolkit for green hospital. From a hospital engineer, they also make engineered standards, but we need to make it into a national standard one, so everyone can understand and can start to follow from different steps. Just like when we are building segregations on our healthcare system from primary, secondary, and tertiary, because we have to make all of healthcare professional participated no matter what class of their hospital are. They have to have some step from the easiest one until the most complicated one, so they can start it now. And to make this come to attention, we have so many toolkit. We have so many items from GGHH and also from the ACWH. But how to make it be heard by our government? We have to make a good audiences with our legislative, with our executive. So when they try to make a new policy, that new policy is not an outdated one, but already implementing a good toolkit that's been proceeded, so they can be more up to date. I think that's quite summarizing the problem of initiating. Thank you.
Thank you, Dr. Ray, for your sharing from the Indonesian context. Let me hear the third voice, the third contribution to, again, question 1 or even related question 2. Go ahead. Let me see some volunteers. Can I call on Madison? May we hear your thoughts on the topic for this breakout discussion, please? Madison.
Hello po. So I guess for the question number 1, the challenges that hinder our national government, I guess right now is COVID-19. With the pandemic, there are currently a lot of additional materials which are not necessarily sustainable, and at the same time, I guess you could see the amount of face masks and PPEs being used not just by the health sector but also by the lay people. And there is still, I'm not sure, but there is still it's still an ongoing issue. How are we going to dispose of this stuff? And we are also and also, I guess it's also a matter of focus, because our focus right now are the vaccinations and COVID pandemic. I guess there is really a need to highlight this decarbonization effort as in parallel with the pandemic. Thank you.
Thank you, Madison. Madison, what organization are you again representing?
Sir, I'm a medical officer of Central Luzon, Center for Health Development.
That's right. Thank you so much. While we are with the DO8 in Central Luzon, let me call another colleague of yours. I hope Engineer Philip can turn on the megaphone. He's from the Central DOH of the Department of Health here in the Philippines, and maybe share your thoughts on the questions. Sir Philip, I hope you're hearing me. Can you grab the megaphone and share your thoughts, please?
Hello, sir. Good afternoon. Good afternoon to everyone. Good morning. Actually po, for the hinder on the national government in the Philippines
maybe
right
we
now.
can, sorry, Engineer Philip, to interrupt.
Yes, ma'am.
We can move closer to Engineer Philip, but Engineer Philip, if you want, you can turn on your megaphone. There's a megaphone icon right next to your microphone.
Yeah, so everyone will hear. Yeah, so everyone will. Okay,
Hello.
go ahead.
Is it better na po? Yes po. So again po, I'm Engineer Philip Ruiz from the Health Facility Development Bureau of the Department of Health. So I think for the hindrance from the national government as of the moment for the commitment of the sustainable low carbon initiatives in the health sector is the major hindrance is the commitment for funding or the commitment of the leadership in terms of the funding for these climate smart health facilities or for the sustainable low carbon initiatives in the health sector. Actually, we have gotten some statistics that only 0.5% of the national allocation are being part for the climate change in the health sector. So this not priority. We cannot say that is not priority, but we are on the way on how we could help in terms of the greening of our hospitals and some initiatives that can be helped. And I think not only the commitment, but also we are now in the we are saying that not because of the COVID, but prior to the COVID, we have the commitment from the health sector to provide some initiatives to fight against the greenhouse gas emissions. And I think that's for now po. So I will just chat po some of the hindrance that we are currently having. Thank you.
Thank you so much, Engineer Philip. There are, I think, one or two more that we want to hear out of this very small group indeed. Many are in the other group. These are the hospital-focused discussion. Amita, Lieutenant Colonel Amita, may we hear from you again, please, on question 1, 2, or 3, please. I don't think she heard us. Engineer Alvin, do you hear me? Can we also listen to your thoughts, please? And we have about 7 minutes left. Engineer Alvin, go ahead. Again, turn on your mic or grab the megaphone, please. Okay. Are there other things that those who have spoken up would want to for example, for the PhD in Central Luzon, what tools and resources do you need? What help do you want to be extended to you such that hospitals in Central Luzon can begin taking action on climate, both in mitigation and adaptation, both in resilience and in decarbonization of healthcare in Central Luzon? Can we hear again from you?
Hello. So.
Yes, we hear you. Go ahead.
Yes. So I guess for some help, I guess I would like to encourage more of our health facilities to know more about the efforts of the Global Green and Healthy Hospitals. And then I guess it's also a good help that the Health Facility Development Bureau, our mother bureau, already have a green health facility, a green manual, a green hospitals manual that we are about to review. But I guess yun nga, right now, I guess we will look into other partnerships and I guess training on uh, to how we can dispose of the waste. I guess that and how to promote it in the different hospitals. And I guess we should also look beyond the healthcare waste, but also have model hospitals in the area, not probably not just in the region, but in the Philippines to really actively promote how to become a green hospital. Thank you.
Thank you. In which case, therefore, do you think, apart from the assistance of the central DOH,
Please use
group,
megaphone. Thank you.
sorry, groups like Healthcare Without Harm can help address your certain needs, Madison? Or sorry, or Roy? I should address that question to Roy as well. Do you think we can help from Healthcare Without Harm in the context of question 3 already? We are already down to our last 1 or 2 minutes, maybe. Okay, question 2. Through climate financing, incentive mechanism, and collaboration with other stakeholders and public-private partnership. Thank you. Thank you.
Dr. Madison was responding to your question earlier.
Okay.
But use your megaphone.
Okay.
Regarding the question that if you could help, I guess you could really help us in promoting this advocacy, and I guess it would give a inspiration to the health facilities in the region, particularly since Region 3 is one of the largest regions in the country, and we are actually seeing a lot of developments with the presence of Clark. So I guess you could use that as a pivot point in promoting not only Clark Green City, but also the health facilities within the Clark area as green hospitals. And I guess I've seen a chat here on certifying green professionals. I guess it would help if the health facilities know about the certifications and about these mechanisms. Thank you.
We should move on to the last question or last responses, Sir Mon. So we
Yeah,
can.
thank you for all the feedback and the contribution from our participants. We're out of time already, unless there is 1 or 2 pressing matters that you would want to raise now. Please do. Otherwise, we're ready to go back to the big room. Are we supposed to report this out, Jit?
Sir Mon, if you can just give a brief summary of the discussion or the highlights. Okay.
And we can bring these notes to that room.
Yes, we will present this. Thank you.
All right. Okay. Thank you so much, everyone. So we will be led automatically. Is that right? Jit, you don't need to leave, right?
Click. So I'll give instructions. We have to click GHAC 2021 stage. Please go back to the pre-GHAC 2021 stage by clicking the room.
Okay, see you there. I'm going.
All right. I think we are waiting for a few more participants from the room to join and come back to the stage from breakout A and breakout B. But thank you very much for those who are already here who have participated in our breakout sessions. And we will have a very, very quick summary or reporting back from our facilitators on the highlights of the discussions from the breakout. Thank you. All right. Good afternoon again, everyone. Thank you. We're going to now ask our facilitators to present very quickly the results of the discussion. May I ask Sir Mon and Ming Nan to go on stage, but please mute until you are going to speak. Please make sure Dr. Lynn has hosting capabilities there. Thank you so much for very kindly facilitating the discussion. I will share the screen, and I'll ask Sir Mon to start the reporting. Please unmute your mic.
Good afternoon once again. I was the moderator for the group talking about national commitment on low carbon healthcare. Briefly, we asked 3 questions. First question is, what are the challenges being met at the national government level, stopping them or hindering them to commit to sustainable low carbon healthcare? Whether it is from India or from the Philippines or even in Indonesia, the answer is yes, there are indeed challenges at the policy level. One, at the policy making level, at the Ministry of Health, there also lack of awareness. And there's an even lack of appreciation of the existing policies that may help sustainability in healthcare. There's a need for national standard, which national healthcare professionals and hospitals can utilize. There is an example of this toolkit, for example, in the Ministry of Health in the Philippines, but not yet fully utilized. And in Indonesia, there's need to promote those national standards. And of course, political commitment and leadership is necessary, which will be translated into actual funding support for climate smart healthcare in the Philippines. For example, only 0.5% of the national budget is allocated for such. Now, for question 2, what are the tools and resources that are needed? There's really a need to help and encourage more facilities to take the effort similar to those being done in the in the Global Clean and Healthy Hospital Network. There is a manual, but there is more intense need to conduct training, even for example on waste management, and make sure that those trainings penetrate across hospitals, even in the public hospitals at the country level. And then there's a need to go beyond waste and take up other sustainability issues. And then the other mention here, there's a mention of climate financing as well, and to certify more trainers to be able to do training on climate impact checkup. Maybe, Jit, I should stop at that to give time to Dr. Lynn on his own group report. Thank you.
Sir Mon, Doc Lynn, I'll share the results.
Okay.
Lynn, you should turn on your mic.
Yeah, I turned on my mic already. Can you hear me? Can you hear me?
Yes, Dr. Lynn, we can hear you.
Okay. Thanks for the input of our partners. Now we have three questions. The question one is the individual level, the facility level. Are there challenges that hinder the healthcare facility from committing? Yeah, I think that our friends from Indonesia and the one is because finance is also always very important if we want to invest on like some new equipment or how to reduce the air conditioned electricity use. So we need to have some financial support. And then this public sector maybe have some support from the government, but private sector it's not easy to get that kind of support. So the policy is very important, not only for public sector, and then support from the leader, because decision maker will put priorities on different subjects, different like health, medical quality or patient safety, but we need the support from the healthcare leaders. So change their mindsets is very important. So this is kind of challenge. So we need to educate. We share the concept. Yeah, I think that's so. So this is I call why we need to let everybody know more about why we have to do that. The direction is very important, and then start from the young people. So this is the challenge we face. If we can, put that on the same boat, that the financial problem maybe we have a chance to change, to improve, and then the support from the government and also from the hospital leaders. And the second one is that what tools and resources we need to facilitate our own healthcare facility to initiate this kind of initiatives. There are some tools already available, like there are some best case studies in healthcare without harm websites. Or if you want to calculate your carbon footprint, we can join GHS and then the Hippocrates. There's this kind of tool that you can track the annual carbon footprint, and then I think this is very important. The other one that we need to we can do is that because I think that is also a friend from Indonesia said that individual hospital, if we can have like a corporation, like you have a society, a Green Hospital Society, or you can have like in Taiwan we have the Healthier Hospital Society, but we have Green Hospital chapters, committees in the society. So if you can, in your medical association, or you have your own Green Hospital Society, and then you can put all the hospitals who are interested online, and so they can share experience. Maybe they can have best practice. They can maybe have their benchmark learning from the benchmark hospitals. So this kind of cooperation that you can show to your fellow hospitals or healthcare facilities that can work together, because you are in the same country, you have the same policy, the regulation is the same. So you can work together to maybe for those hospitals who are not on board, you can because you have this kind of hospitals, they can provide examples for them. And the third one is for Race to Zero. Because Race to Zero is not that easy. As far as we committed to be Race to Zero, we are still learning from them, especially the other hospitals from other countries. It is a big movement around the world. So I went to COP26. One of the important goals is that I can learn from other countries how to become
zero emission. So I think that we need the global experience. Also, like Sonia talked about that, Healthcare with Harm is working with WHO for Scope 3, or Scope 1, Scope 2, Scope 3, how to calculate. We also need the international NGO like Healthcare Without Harm, or like other NGOs, Global Green, Global Health and Climate Alliance, develop this kind of tool that we can truly put into our daily practice, and also share with our government to make this kind of policy, to give subsidies to the hospitals. Yeah. And then this also, we can put these kinds of standards for hospitals, that we can learn this kind of experience from different hospitals. So this is what we all the partners in this group we share. Thank you. Thanks for all the partners.
Thank you so much, Dr. Lynn and Sir Mon. You may now leave the stage, but very, very grateful for your facilitation of the breakout sessions, and to all who have participated. Thank you so much, and we will share with you the results of this breakout session, as well as the results of the conference after the end of the event. So we are now at the end of our session for Day 2, Decarbonizing Asian Healthcare. Now, I would like to really, really thank everyone who stayed until the end of the session, and who have actively participated, even through chat. For those who weren't able to turn on your mics and cameras, thank you so much. And there is one more event after this. It's a side meeting, and we'd like to have you there. It's a RISE Southeast Asia Alliance for Health and Climate side meeting. So this alliance is composed of different healthcare professionals and climate advocates around the region, and we'd like to discuss and check in with our members who are here, and also to introduce the alliance to some of you. It's going to be a quick one. We'll try to keep it not more than 30 minutes. If we can do it in 20 minutes, that would be great. And we have a speaker from RISE Southeast Asia Alliance, Dr. Reynaldi Prabowo, who will be speaking at that meeting room. So the meeting room is now open, RISE Southeast Asia meeting room. You will see that on the list of the rooms that you have. But I'd like to thank again everyone for joining this main session, and we hope to see you in the side meeting today, and also in our third and fourth sessions next week, scheduled on December 7 and December 9. So if you haven't signed up or filled in the attendance for today, please do so. Paeng has copy-pasted the link in the chat box, and we hope to see you in the side session this afternoon still, and in the third and fourth session days of our conference. Again, I am Jit Sohal, and thank you so much for being with us today. See you in the RISE Southeast Asia side meeting. He is. Hi, Dr. Ray. Hi, everyone. So this is a side meeting. It's not really the main session anymore. And we just wanted to check in with you. I know it's kind of late already. We're supposed to end this main session at 4 o'clock, but it's now at 4:25. So we're going to try to make it quick and just share with you why health professionals like you need to take climate action, and also introduce you to the Rise Southeast Asia Alliance. So I just like to ask, can I get an emoji on how you are feeling right now, 2.5 hours after the event? Can I get an emoji from our participants? Still okay, according to Dr. Lynn. Okay, Dr. Ray. Miss Gloria, still on fire, Miss City. Thank you so much. And still celebrating, Dr. Madison. All right, so like I mentioned, we're going to be quick. And if you want to stay close to me, that would be great, so I don't have to use the microphone or the megaphone all the time. But if you want to speak, please feel free to turn on your microphones or raise your hand. So what we're going to do today is just to check in with you. Like I said, you're okay. Like I asked, you're okay, you're doing well. Thank you so much for attending our main session and this side meeting. And then also to introduce you to Rise Southeast Asia Alliance for Health and Climate. I can see that some of the people here are members of the alliance already, but most are not. So it would be such a good opportunity for us to introduce you what this alliance aims to do, aims to accomplish together in advancing climate action in the Southeast Asian region. So I'll share my screen, if that's okay. And then I'll ask Dr. Ray to, I'll start with a few slides, but I'll ask Dr. Ray to continue. All right. Okay. All right. Rise Southeast Asia Alliance for Health and Climate. So, as we all know, we've heard since yesterday that Southeast Asia region, in the Asian region in general, we have been experiencing the climate impacts already. Several reports that were released by the IPCC, the Lancet, proves this current situation that we are experiencing. Sorry, my slides are not showing the picture, but earlier Dr. Lynn tried to show this video, but we weren't able to play it because of technical issues. So I'm gonna play it right now because I think it's such a great setting for this discussion on why we need healthcare professionals to take urgent action in terms of health and climate. So I'm gonna play it now. If you want to move a little bit at the bottom of the screen, or there, I think someone's moving. Okay, there, that would be great. Okay, I'm gonna play it now, and I'll turn off my mic first, and the rest can also turn off their mics.
In Tuvalu, we are living the realities of climate change, sea level rise, as you stand watching me today at COP26. We cannot wait for speeches when the sea is rising around us all the time. Climate mobility must come to the forefront. We must take bold, alternative action today to secure tomorrow. Paftailasi, Tuvalu Modelo. Climate change and sea level rise are deadly and existential threats to Tuvalu and low-lying atoll countries. We are sinking, but so is everyone else. And no matter if we feel the impacts today, like in Tuvalu, or in 100 years, we will all still feel the dire effects of this global crisis one day. In Tuvalu, our islands are sacred to us. They contain the mana of our people, They were the home of our ancestors. They are the home of our people today. And we want them to remain the home of our people into the future. This is why this call to you from Tuvalu is not just a political statement. It is a call that reverberates from our 8 islands and our 12,000 people to the international community.
And share something about that video. I'm sorry I wasn't able to play it earlier, but I'd like to give you the opportunity to share what you were supposed to mention about the video earlier.
I think you want to join COP26 is, I think it should be a wake-up call for all the people around the world, not only the healthcare sectors.
Thank you, Dr. Lynn. Indeed, yesterday we were discussing about why are you here, you know, why the big why. Why are you fighting for climate change, and why are you fighting for the environment? So most of the answers that we got is basically because we've been experiencing the impacts of climate change in our communities, in our personal, in our health, in our children's health, in our family's health. So these are just some of the data that we have about the impacts of climate change on human health. And, you know, all of these harmful impacts interact with socioeconomic and biological factors, including age, gender, income, race, such that the more vulnerable, the health of the more vulnerable, the marginalized, the disempowered, they tend to be harmed first and worst, in the words of Ed Maybach. So definitely, like Dr. Lynn said, this crisis is also a major issue of equity and justice, as disempowered groups are suffering the greatest burden. So definitely everyone will be affected, like what the minister from Tuvalu mentioned. I will not show this video anymore because it's kind of very long. So I will ask, I'll just proceed to the next slide, which is a message from the UN Secretary General saying that humanity is waging war on nature. And as you know, this war will not only affect us, not only affecting us, but will affect the future generation, our children and our grandchildren. So it's really important. It's a defining task of the 21st century. The top priority of everyone, including the healthcare sector, to fight this war, to win this war and make peace So how can healthcare professionals contribute to protecting not only human health, but also the health of the planet? As trusted advocates, like what our speakers mentioned earlier, health professionals and health organizations can and must join the growing national and global communities of science-based advocates working to achieve the goal of the Paris Agreement in pursuing climate action. In the words of one of the public health and climate change communication experts, doing so can be your greatest contribution to the health and well-being of all people, especially the world's most vulnerable, marginalized, and disempowered people who tend to be harmed first and worst. Like what Shweta, Sonia, and Dr. Lynn mentioned earlier, there has been a growing movement of health professionals like you who are standing up and talking about the need for climate action in the sector. And we need more of you. We need our emerging healthcare leaders like Sarah Shu, who is a third-year medical student at Brown University, to take on this power and capacity that they have to change these systems and support health beyond the walls of the health sector, but support health of the planet as well. So I will now turn over the floor to the RISE Indonesia President, Dr. Reynaldi Prabowo, to introduce you to one of the healthcare professional networks in the world and the only one in Southeast Asia working on health and climate, the RISE Southeast Asia Alliance for Health and Climate. Dr. Ray?
Thank you, Jit. Can you hear my voice?
Yes, Dr. Ray.
Sure, then. Thank you, Jit, for the opportunities, and thank you, everyone. So my name is Reynaldi Budi Prabowo. You can call me Dr. Ray. I'm from Indonesia and also a president in the RISE of Southeast Asia Alliance of Healthcare and Climate in Indonesia chapter. So because our time is quite running out, I'm going to tell you the stories, short stories, no more than 10 minutes, about the alliance that's been starting to make a change towards the health and climate in Southeast Asia and to the world internationally. Next slide, please, Jet. We are an alliance that's been formed not more than 2 years ago. We've been firstly communities that been found by a healthcare professional, either it was a medical professional or non-medical professional that working in healthcare environment, like a doctor, like a nurse, like a midwife, and also some environmental practitioner, engineers, and hospital managements and others participants in healthcare that's been concerned and been alerted that that's what, like in the Tuvalu's videos before, say that our world is in danger of a climate change, and unfortunately our healthcare system is also contributing towards that. And it was really awful to us to imagine that we cannot have healthy people on a sick planet. To have a healthy people, we have to keep our planet healthy as well. So in that same vision, we are trying to make an organization, quite an informal one, but quite a boundaries of alliance that's been established, and we have a vision to make a climate action, health equity, resiliency, and healthcare recovery, and also integrated in a prioritized in national and regional action and policies in Southeast Asia. And our missions are to build a competent, inclusive alliance that no matter what of your professional background, either you are medical professional or not, but as long as you are concerned in a healthcare contributing towards carbon emissions, you can joining us here in. And we also encouraging many healthcare students, from medical students, nursery students, and others healthcare colleges towards joining our movement in advanced climate action, health equity, resiliency, and healthy recovery in Southeast Asia. And as you can see in our breakout room now, we still have around 18 people here, and many of these participants already joining us in the RISE, and it's really happy to see Mon again, Jit, Dr. Lynn, and also Paeng. We've been going through for almost 2 years and achieving so many things. Next slide, please. This was our focus areas, and that in this alliance we can make a good capacity buildings, sharing how we can advocate and push the policy engagements toward the climate and health, and also building alliance and boundaries, push out the boundaries between nations. Just like what we can see that what's been good to be developed in Philippines, we try to adopt it in Indonesia. What in Taiwan's already received a good progress, we also try to develop it and share the good vibes towards the other as well. And education, capacity building, and research also becomes parts of our three foundations of our focus area. Next slide, please. What's very amazing about this alliance, it's just starting at October 2020. At that time, we are in the middle of the early period of pandemics. Our talking topic is more about waste management, and also about the hospital system that cannot cope up with the pandemics that becomes an airborne infections. But as the years follow, we are developing towards a more growing communities that we are talking about how to raise a national awareness. Some of our country chapter try to make a national seminar, and try to make a national assembly of hospital and healthcare, and these ideas are growing and try to get some attention. So we are inviting you all to joining the chapter of RISE in every of your country. If there isn't any, you can start to build one. Next slide, please. And some of our this was the start of our meetings, and we are continuous until 2020 and make another. It was 2020, I think, JIT, not 2021. The first healthcare RISE alliance been published almost years ago. Next slide, please. And also next. The country chapters been followed after that meetings that been held in so many countries, like Philippines, in Malay, in Indonesia, in Taiwan. We try to build our capacity in each of the countries and brings the good vibes on it. And the RISE Taiwan country chapter was launched in October. And next. Then they said that they were very good national seminars at that time. Next slide, Jit. And we try also to push our, I think before, the letters concept will be really good one. We try to advocate our issues and our concern, not to push and only asking, but we also offering our help, our connection of knowledge and toolkits towards Indonesia, towards the government of every nation. And we also send our letter in Indonesia, we send it toward our MOH and also towards some of executive members. And in the other countries, in the national chapter, we also send it towards the UN climate units and the other participants and stakeholders as well. I cannot see this slide yet. Are you still loading in?
Is it Dr. Ray?
Yeah. It's still loading in, I think, in my computer.
It's actually showing on my end. Is it showing on other participants?
I think not yet showing on my...
Climate prescriptions is the new slide.
Yeah. Okay, then. I think we should continue forward.
Do you see something, Dr. Ray?
No, I'm not.
Okay.
Maybe the connection problems. Yeah, it's still three dots on my screen. But you can follow through. You can continue towards this alliance objective and also this alliance growing. That we send the letters towards some of our stakeholders as well, and you can also do so, not in a condition of pushing them to make a good policy or the others. That all of our governments, we are sure they have some, at least a little concern toward climate change, but the policies that they've been developed need to have some additional information from a professional perspective. So that's why we, a healthcare professional, either as a medical or non-medical one, should take a role to make an advocacy towards it. By gives some of our advices to them, we really hope that they can make a good impact of healthcare, of the environment and healthcare policies that can lower the carbon emission. As Dr. Lynn said before, all of us are running together toward the race to the zeros. It's okay to start slow, but we cannot be forever slow. We cannot be forever late. We have to speed up and catch up so we can reach our zero carbon emissions faster before the catastrophe happens. We have so many toolkits. Like means today we have got some presentation from Sonia and also from Mon and also Dr. Lynn. We have several tools like carbon toolkit tools and also ship protocol tools for healthcare procurements. But if this information are only collected in an elitist or only in some close communities, it cannot give a good impact. We have to spread it out. We can, so all other healthcare facilities can start in which part they can start. They can start in a primary state, they can start in a secondary or in tertiary one. But this knowledge, this network need to be spread and disseminating towards the communities. And this alliance, RISE, an alliance of healthcare in climate and health, is really helping us to do so. So we are really encouraging all of our participants to joining towards this alliance. It was not so bonding, but it's so really helpful and keep our spirit burning up so we can race together in the race to zero, not as a competitor, but as a partner. Thank you, Jit. I think I already spent my 10 minutes.
Great. I'm just showing the participants some of the slides from the presentation.
Yeah.
Their presentation, which can be, there are several tools that the Alliance released and several initiatives in relation to advocacy and policy engagements like what Dr. Ray mentioned. And yes, and then we need to move forward and keep the momentum going. Actually, last November 18, we celebrated the first anniversary.
Yes.
So in that anniversary, we also launched the manifesto to reclaim our health, containing 10 actions addressed to the ASEAN, our national governments in the region, and our healthcare facilities to help us and lead us in reclaiming our health and reclaiming our future in the region. So we will type in the room chat the links to these materials that you can check out. But like what Dr. Ray mentioned, we really encourage you to join the alliance of healthcare professionals and climate advocates in the region with RISE Southeast Asia. So if you want to join the movement, and there are so many exciting things happening next year, and we look forward to having you as a member of the RISE Southeast Asia Alliance. So thank you so much. If you have any questions, please feel free to raise it here in this meeting room before we wrap up and the side meeting. We'd love to hear from you what you think, and if there are any questions that we can answer in relation to joining the movement of healthcare climate action in the region. We have several RISE Southeast Asia members here who can answer any of your queries. Thank you so much. Okay. If there are no more questions, or if you have no clarifications, and I'm pretty sure we have the links to the materials that we mentioned and the links to joining the movement of RISE in the chat box. If not, may I ask our team from Healthcare Without Harm to share these links in the chat room. And I propose a photo opportunity. Maybe we can do a class photo together, if that's okay. So that would mean we need to move around so that everyone will have space to open their videos, and that everyone will have space in the class photo. All right. So may I ask everyone who can turn on their videos to turn on their videos so we can take a photo before we end the side meeting, and we will see you in the next sessions of the pre-GHAC, and hopefully in the next meetings of the RISE Alliance. Right, Dr. Ray? All right. I think I'm the only one with the video and sermon. All right. I'm going to take a photo, or can someone help me take a photo? All right. All right. 1, 2, smile. Okay. All right. Well, thank you, everyone. I know it's really late now compared to what we were supposed to. Okay, I'll take one more photo because more people are turning on their videos. But 1, 2, 3. All right. So thank you so much, everyone. Links are now pasted on the room chat, and please check out some of the tools that we've launched and joining the RISE Southeast Asia Alliance. Thank you, and have a good day, good night, everyone, and see you on December 7. Bye-bye.
Bye-bye.
Thank you,
Bye-bye.
Dr. Ray, Sir Mon.
Bye-bye.
Yes, to the participants and the Healthcare Without Harm team.
Thank you, everyone. Stay safe. Bye.
Bye-bye.